More in-depth overview of all drugs. Opioids are a class of drugs that include natural substances like morphine and synthetic drugs like fentanyl. They are primarily used for pain management due to their ability to interact with opioid receptors in the brain, reducing pain sensations. Opioids can also produce feelings of euphoria and relaxation, making them highly addictive. Opioids, heroin, oxycodone, hydrocodone, morphine, methadone, fentanyl, codeine, have street names as such. Heroin, smack, junk, horse, H, dope, skag, brown sugar, black tar, China white. Oxycodone, oxy, OC, ox, roxy, perks, short for Percocet when combined with acetaminophen. Hydrocodone, Vicodin, Norco, Vikes. Morphine, M, Miss Emma, Monkey, Roxanol, brand name. Fentanyl, Apache, China Girl, Tango and Cash, Murder 8, referring to the high potency and risk of overdose. Codeine, Lean, Purple Drank, Scissorp, Captain Cody. Methadone, Meth Done, Amadona. Buprenorphine, Suboxone. Subs, subbies, orange footballs, referring to the shape and color of some tablets. Hydromorphone, dilaudid D, dust. Meperidine. Demerol, Demis. The opioid crisis, a global health issue with devastating consequences, has claimed countless lives and deeply impacted individuals, families, and societies. I'm going to delve into the opioid drug family from a scientific and evidence-based perspective, discussing treatments like Suboxone and methadone, successful therapies for opioid addiction, risk factors, overdose statistics, economic costs, physiological effects, and addiction potential compared to other substances. Two common treatments for opioid addiction are Suboxone and methadone. Both aim to reduce cravings and withdrawal symptoms while helping individuals regain control of their lives. Suboxone. This medication contains a combination of buprenorphine and naloxone. Buprenorphine is a partial opioid agonist, meaning it activates the opioid receptors but with less intensity than full opioids. Naloxone blocks the effects of opioids. Suboxone can help with withdrawal symptoms and cravings without producing a significant high. Methadone. Methadone is a full opioid agonist that helps reduce cravings and withdrawal symptoms. It is typically administered in a controlled clinical setting to minimize the risk of abuse. Methadone maintenance programs have been successful in stabilizing individuals with opioid use disorder. Pros and cons of Suboxone and methadone. Suboxone. Pros: lower risk of overdose compared to full opioids. Reduced withdrawal symptoms. Lower potential for abuse due to the presence of naloxone. Cons: potential for misuse, particularly if not taken as prescribed. Limited availability in some regions. Methadone. Pros: effective in reducing cravings and withdrawal symptoms. Long-acting, reducing the need for frequent dosing. Established success in maintenance programs. Cons: risk of overdose if abused. Must be administered in a specialized clinic, making it less accessible. Behavioral therapies, when combined with medication-assisted treatment, have shown success in treating opioid addiction. These therapies address the psychological aspects of addiction and help individuals develop coping strategies and relapse prevention skills. Cognitive behavioral therapy, CBT, and contingency management, CM, are commonly used. Risk factors for developing opioid addiction. Several factors increase the risk of developing opioid addiction. Genetics. A family history of addiction can predispose individuals. Psychological factors. Conditions like depression, anxiety, and trauma can contribute. Social environment, peer pressure, and exposure to drug use in the community. Prescription use. Legitimate medical use of opioids can lead to misuse and addiction. Overdose statistics and economic costs. USA. The USA has faced a severe opioid crisis with approximately 70,000 overdose deaths in 2019. The economic cost is estimated to be over $78 billion annually. Europe. Europe also struggles with opioid addiction, with countries like the UK experiencing an increase in opioid-related deaths. Economic costs vary by country. Australia. Opioid overdose deaths in Australia are rising, leading to a significant economic burden on the healthcare system. Physiological effects of opioid use. When an individual is high on opioids, they may experience euphoria, a sense of intense pleasure and relaxation. Pinned pupils, constricted pupils, often a telltale sign of opioid use. Slurred speech, reduced motor coordination and slower speech. Sedation, extreme drowsiness and reduced alertness. When withdrawing from opioids, the body experiences nausea and vomiting. Gastrointestinal distress is common during withdrawal. Muscle pain, aching muscles and joint pain. Anxiety and agitation, heightened anxiety and restlessness. Insomnia, difficulty sleeping. Opioids are highly addictive due to their potent effects on the brain's reward system. The risk of addiction is significant, and the withdrawal symptoms can be severe, often driving individuals to continue use to avoid withdrawal. Compared to many other substances, opioids are among the most addictive. Contin, a brand name for extended-release morphine, gained widespread use due to its effectiveness in managing chronic pain. Its extended-release formulation provided long-lasting relief, reducing the need for frequent dosing. However, the surge in Contin prescriptions was partly influenced by aggressive pharmaceutical marketing practices targeting healthcare providers. Pharmaceutical companies promoted opioids like Contin as safe and non-addictive, downplaying the risk of addiction and overdose. Misleading marketing tactics led many doctors to prescribe these drugs liberally, contributing to the opioid epidemic. Patients who relied on Contin often faced escalating doses, inadvertently increasing overdose risks. This highlighted the dire consequences of marketing-driven overprescribing, resulting in countless lives lost to opioid overdoses. The pharmaceutical industry, often driven by profit, has faced criticism for a range of issues. The pursuit of blockbuster drugs can overshadow research into less profitable treatments, potentially limiting medical advancements. While the industry has undoubtedly brought life-saving drugs to market, concerns about transparency, pricing, and ethics persist, prompting calls for reform and increased scrutiny. The life of someone in recovery from opioid addiction, relying on a Suboxone program, is a journey marked by resilience, hope, and determination. They face daily challenges, navigating a path fraught with risks, temptations, and societal stigma. Each day can be a battle against the lingering temptation of opioids as cravings persist. The fear of relapse is ever present, a constant reminder of the fragility of recovery. The struggle to rebuild relationships, regain trust, and mend broken bonds can be heart-wrenching, often accompanied by feelings of sadness and guilt. Yet within this struggle, there is strength. Those on the Suboxone program show incredible courage, confronting the dual burden of addiction and stigma. They learn to cope with the judgment of a society that may not fully understand the complexities of addiction. Through therapy and support groups, they find solace and community, sharing their stories and triumphs. Their journey embodies the resilience of the human spirit, demonstrating that recovery is possible despite the odds. On this journey, those in recovery, on a Suboxone program, learn not only to overcome addiction, but also to rise above the judgment and prejudice they face. They are survivors, warriors, and beacons of hope for others still trapped in the darkness of addiction. I have found in my counseling that people who have been on the dark road of addiction and have gotten to the end of themselves tend to be contrite and humble, truly knowing the fragility of being human. Because they have come to the end of themselves, they are in a good position to remain humble and be open to the help they need. Many people who haven't been on this journey can be grandiose and self-reliant. They haven't come to the conclusion that humanity has been created to be dependent on their creator, and they are still thinking that they can do it without external help. I remind people that there is more to them than their past addiction. They don't need to be identified as an addict or past addict. This is something that they got caught in, not who they are. People need to see that they are infinitely valuable. They need healing in this hostile world. They may be broken, but they are no more broken than anyone else. Going on a road of self-discovery is also a very healing thing for people caught in addiction or overcoming addiction. When they have gotten to the other side and are out of the woods, it is really important to develop life skills, deal with past trauma, mend broken relationships, forgive themselves, face their fears, walk towards their future step by step. Most importantly, remain in hope. Alcohol. Alcohol, a widely consumed psychoactive substance, has a complex relationship with human health and society. Let's explore alcohol from a scientific, evidence-based, and addiction counseling viewpoint, covering treatments, therapies, risks, mortality rates, economic costs, physiological effects, and addiction potential in comparison to other substances. Understanding alcohol. Alcohol, known chemically as ethanol, is a depressant that affects the central nervous system. It's one of the most commonly used and socially accepted psychoactive substances globally. Its consumption can lead to feelings of relaxation and reduced inhibitions, but it also carries significant risks. Alcohol addiction and treatments. Alcohol addiction, also known as alcohol use disorder (AUD), is a chronic disease characterized by an inability to control drinking despite negative consequences. Several treatments are available. Naltrexone. Naltrexone is an opioid receptor antagonist that reduces alcohol cravings. It can be taken orally or as a monthly injection. Pros include its effectiveness in reducing relapse risk. Cons may include side effects like nausea. Disulfiram, antabuse. Disulfiram interferes with alcohol metabolism, leading to unpleasant reactions, such as nausea and flushing, if alcohol is consumed. Its pros include its deterrent effect. Cons include its side effects and the need for strict adherence. Calcium carbamide, caltrate. Caltrate works similarly to disulfiram but has a milder reaction to alcohol. Its pros include reducing alcohol consumption without severe side effects. However, it may be less effective for some individuals. Effective therapies for alcohol addiction. Several evidence-based therapies have proven successful in treating alcohol addiction. Cognitive behavioral therapy, CBT. CBT helps individuals identify and change unhealthy behaviors and thought patterns associated with alcohol use. Motivational enhancement therapy, MET. MET is a client-centered approach that enhances motivation to change drinking behaviors. 12-step facilitation. Based on the principles of Alcoholics Anonymous, AA, this therapy encourages participation in AA meetings and adherence to its steps. Family therapy. Family involvement can be crucial in addressing the impact of alcohol addiction on relationships and support systems. Risk factors for alcohol addiction. Several factors increase the risk of developing alcohol addiction. Genetics. A family history of alcoholism can increase susceptibility. Psychological factors. Conditions like depression, anxiety, and trauma can contribute. Social environment, peer pressure, and cultural norms regarding alcohol use can play a role. Early initiation. Starting alcohol use at a young age increases addiction risk. Alcohol-related mortality and economic costs. Alcohol-related deaths encompass not only accidents, but also health issues like liver disease, heart disease, and certain cancers. In the United States, alcohol contributes to over 95,000 deaths annually. In Europe, alcohol-related deaths are estimated at over 230,000 per year. In Australia, alcohol contributes to around 500 deaths annually. The economic costs of alcohol-related issues, including healthcare, productivity loss, and law enforcement, are substantial and vary by country. Physiological effects of alcohol intoxication. When a person is intoxicated with alcohol, they may experience impaired coordination, slurred speech, poor motor skills, and reduced reaction time, euphoria and relaxation, feelings of happiness and reduced anxiety, memory impairment, difficulty recalling events that occurred during intoxication, lowered inhibitions, increased risk-taking behaviors, and reduced self-control. Alcohol withdrawal. When an individual who is physically dependent on alcohol stops drinking, they can experience withdrawal symptoms, which may include tremors, shaking and nervousness, nausea and vomiting, gastrointestinal distress, anxiety and depression, mood disturbances, insomnia, difficulty sleeping. Someone is at risk of death if they are heavily drinking and cease use suddenly. People can have seizures and die, so withdrawal therapy for 5 days in hospital is required when someone is a heavy drinker and/or dependent on alcohol as they detox from alcohol. Benzodiazepines such as diazepam are used to step the client down from intoxication and dependence, stopping severe withdrawal symptoms and the chances of the client having a seizure. Addictiveness compared to other substances. Alcohol is considered moderately addictive compared to some other substances. While it may not produce the same immediate physical dependence as drugs like opioids, long-term alcohol abuse can lead to severe addiction. The psychological and social aspects of alcohol addiction can be particularly challenging to overcome. In conclusion, alcohol presents complex challenges from scientific, therapeutic, and societal perspectives. Effective treatments and therapies are available, but the consequences of alcohol abuse are far-reaching, impacting individuals, families, and economies. Understanding the risks and seeking help when needed are critical steps in addressing alcohol addiction and its associated burdens. The life of someone battling alcohol addiction is a journey marked by profound challenges, resilience, and the relentless pursuit of recovery. It's a path fraught with risks, relentless temptations, and enduring struggles. The journey begins with the allure of alcohol, offering temporary solace and escape from life's hardships. Yet as the addiction takes hold, the initial relief transforms into a relentless craving that consumes one's thoughts and actions. Struggles become a daily battle as relationships fracture, health deteriorates, and responsibilities crumble under the weight of alcohol's grip. The sadness that pervades is not just from the physical toll, but also the emotional toll, as alcohol isolates and intensifies feelings of despair. The stigma surrounding alcohol addiction can be crippling, often leading to shame and isolation. Society's misunderstanding and judgment can deter individuals from seeking the help they desperately need. But within this struggle, there's strength. The strength to admit vulnerability and the courage to seek recovery. It's a journey marked by countless attempts and setbacks, where hope remains the guiding light. It's about confronting the past, forgiving oneself, and rebuilding a life with newfound purpose. As a society, we must replace judgment with compassion, recognizing that addiction is a disease, not a choice. By extending empathy and support, we can help those on this arduous journey find their way back to a life of sobriety, health, and renewed hope. Amphetamines. Amphetamines, a class of stimulant drugs, have significant implications for public health, ranging from their legitimate medical uses to their potential for misuse and addiction. This comprehensive article explores amphetamines from scientific, evidence-based, and addiction counseling viewpoints, covering treatments, therapies, risks, mortality rates, economic costs, physiological effects, and addiction potential in comparison to other substances. Understanding amphetamines. Amphetamines are synthetic stimulants that affect the central nervous system. They include medications like Adderall, Ritalin, and illicit substances such as methamphetamine, meth. When used as prescribed, they can treat attention deficit hyperactivity disorder, ADHD, and narcolepsy. However, misuse and abuse can have severe consequences. Amphetamine addiction and treatments. Amphetamine addiction, also known as amphetamine use disorder, AUD, is characterized by compulsive use, tolerance, and withdrawal symptoms. Several treatments are available. Behavioral therapies. These therapies, such as cognitive behavioral therapy, CBT, and contingency management, focus on addressing psychological aspects of addiction, including triggers and coping strategies. Medications. In some cases, medications like modafinil, a wakefulness-promoting agent, may help reduce amphetamine cravings and withdrawal symptoms. However, there are limited medications specifically approved for amphetamine addiction. Effective therapies for amphetamine addiction. Cognitive behavioral therapy, CBT. CBT helps individuals identify and change problematic thought patterns and behaviors related to amphetamine use. Contingency management. This therapy provides tangible rewards for maintaining abstinence, reinforcing positive behavior. Motivational enhancement therapy, MET. MET aims to enhance motivation and commitment to quitting amphetamines. Risk factors for amphetamine addiction. Several factors increase the risk of developing amphetamine addiction. Genetics. Genetic factors can contribute to an individual's susceptibility to addiction. Mental health. Co-occurring mental health conditions such as depression or anxiety can increase vulnerability. Social environment, peer pressure, and a culture of drug use can play a role. Early initiation. Starting amphetamine use at a young age increases addiction risk. Amphetamine-related mortality and economic costs. Amphetamines can lead to severe health consequences and death, both from overdose and related health issues. Accidents, cardiovascular events, and mental health complications contribute to mortality rates. The economic costs, including healthcare expenses, lost productivity, and law enforcement efforts, are substantial and vary by country. The cost of amphetamine addiction and consumption to the economies of the USA, Europe, and Australia is substantial and multifaceted. It encompasses various expenses related to healthcare, law enforcement, lost productivity, and social consequences. While it's challenging to provide precise figures due to the dynamic nature of these costs, we can offer an overview of the economic impact. Healthcare costs. Amphetamine addiction contributes to significant healthcare expenses. This includes costs associated with medical treatment for physical and mental health issues resulting from amphetamine use, emergency room visits due to overdose, and long-term rehabilitation programs. Productivity loss. Amphetamine addiction can lead to reduced work productivity, absenteeism, and job loss. Employers may face higher turnover rates and expenses related to hiring and training new employees. Criminal justice costs, law enforcement, and legal system expenses related to drug-related crimes, including possession, trafficking, and related offenses, are substantial. This includes the cost of policing, court proceedings, and incarceration. Social services. The social consequences of amphetamine addiction constrain social services. This includes costs related to child protective services, homeless shelters, and programs aimed at helping individuals affected by addiction. Accidents and injuries. Amphetamine use can lead to accidents, injuries, and fatalities on the road and in workplaces. Costs associated with emergency response, medical treatment, and insurance claims contribute to the economic burden. Treatment programs. The cost of providing addiction treatment and rehabilitation services, including medications, counseling, and support programs, adds to the economic impact. Mortality costs. Premature deaths resulting from amphetamine-related health issues contribute to the economic burden. This includes not only the cost of medical care, but also the lost economic productivity of those who die prematurely. Property damage. Amphetamine addiction can lead to property damage, including damage to homes and public infrastructure, resulting in additional expenses. Environmental cleanup. Illicit amphetamine production, such as methamphetamine labs, can lead to environmental contamination and the need for costly cleanup efforts. Families and communities. The social fabric of families and communities is affected by amphetamine addiction, resulting in indirect economic costs through the strain on social support systems and reduced community well-being. Physiological effects of amphetamine intoxication.